Hello everyone, my name is Dr. Joel Rosen and I'm really excited that you're watching this video because it means you have requested for more information on how to beat a fibromyalgia condition naturally. Now the title of this video is called Fibromyalgia and Chronic Pain Syndrome, and specifically, you are not crazy. I know if you're watching this video, then you have probably been to a number of doctors, have probably a stack of paperwork, are probably taking every supplement known to man, and you are still suffering. And the great news is that you're looking for more information because you're watching this video. And if you're watching this video, then I want to let you know that I'm going to answer the two questions that we talked about earlier. Why you? And most importantly, what you can do about it naturally. And I'm here to provide you hope, because there is hope. There's a lot of things that you can do. However, you have to look outside the traditional medical model in order to get the success that you're looking for. So what I want you to do is press pause. I want you to go grab a pen and paper, and I want you to write down things that I'm going to be talking about that are key takeaway points to this particular video. I dedicate my practice to those that are suffering with chronic conditions, whether it's fibromyalgia, chronic fatigue, lupus, autoimmune conditions, Parkinson's, neurological disorders, balance, vertigo and dizziness, chronic pain, musculoskeletal, migraine headaches, peripheral neuropathy, numbness and tingling, gastrointestinal disturbances. And you're probably shaking your head like, yeah, I think I have a couple of those. And probably you do, because most chronic conditions have a lot of underlining themes that we're going to be talking about in this video that's very, very important for you to understand in order to get yourself well. So I congratulate you. I want you to press pause, get a pen and paper, and we're going to go for about 45 minutes to an hour, and you're going to get a lot of information out of this video. So go press pause and go come back and get a pen and paper. All right, so you got a pen and paper. You're going to write down a lot of different things. I'm going to be speaking I'm going to be speaking as quick as I possibly can because I get really, really excited about this. A little bit about myself. My name is Dr. Joel Rosen. I am originally from Toronto, Canada, where I grew up in a traditional medically based family. My mother is a public health nurse that would go into the school systems and immunize the children, so we had all our immunizations up to date. My sister is a family practice doctor. My cousin's a trauma surgeon. My uncle's a dermatologist. So I am a pretty safe to say, medically based child in my family. And I hurt my back after after graduating from college with an exercise physiology degree, and I really hurt it quite badly. And the doctors wanted to do surgery with me, and that was the last thing that I wanted to do. In fact, I knew how to rehab my back myself. I was a trainer for many years. I rehabbed my back, but it didn't quite get me as good as I wanted to possibly get. But the last thing I wanted to do was go for surgery. So I ended up seeing a chiropractor, and at that point it was sort of a light bulb that went off in my head and made me decide that this is what I want to do with my life. I want to help people that could have possibly gone for surgery unnecessarily and rehabilitated their back without the use of drugs or medication, and live the life that you want to live. And I think most of you watching this video, if push came to shove, if you were to get better without having to take drugs, surgery, or medication, then you'd be all for that. So I did that. I went to school in California, and then I moved to Florida. My wife was 4 months pregnant with my twins, and she went on bed rest because she had a very, very delicate birth where she had an incompetent cervix, and they had to do a cerclage, and at any moment we could lose the kids, and it was very, very stressful for me. Besides the fact we moved to Florida, we didn't know a single soul. I had over $150,000 worth of debt, and wouldn't you know it, I injured my back again. And I was really, really scared because I couldn't hardly get out of bed. I was exhausted, I was tired, I was stressed, I couldn't focus, I had brain fog, I had pain, much like a fibromyalgia patient. And so I had a patient come in to see me, and he brought in this book. It's titled, Why Do I Still Have Thyroid Symptoms Even Though My Lab Tests Are Normal? And when he brought this book, I thought, well, that's great, thank you so much, but I don't have any thyroid problems. So I went home and I put this on my bookshelf. And I kept walking by it, and it kind of was screaming my name, come over to me, come over to me. Finally, I opened it up. And again, it was like an epiphany. It was like, I can't believe that I didn't know any of all of this, and this is describing me like a T. Having fatigue, having stress, having an injury, not balancing my blood sugars, potentially reacting to certain foods, my immune system is off, can't fall asleep, can't stay asleep. It was me to a T. So what I did is I decided that I'm going to reinvent myself and dedicate myself to those that are suffering with similar conditions. And so what I've done is I've gone back to school. I went through a graduate program called the Functional Medicine University, so I'm a certified functional medicine practitioner. I'm also a diplomate in the American Association of Integrative Medicine, and I also do functional neurology. So I do a lot of continuing education every month in order so that I can help you. And there's nothing more that I like to do to help a patient and see a patient recover and get their life back that I appreciate more. That's what I'm dedicated to. Besides being a great father and a great husband, it pleases me to no end to give someone their life back that has been written off. And to be honest, the doctors think that you're crazy. They can't find out the reasons why you're suffering. There's no conclusive blood tests, which we'll get into. There's, you're a difficult patient because you ask questions and you want to know about what's going on with your health, and you've read something somewhere that maybe it could be this, and they don't want to do anything with that. And so we're going to give you a lot of hope. And so that's a little bit about me. I've been doing this for about 15 years now. I have to update that slide. I am a certified functional medicine practitioner. I am by training a chiropractic physician. I do also integrative medicine, and I am actually enrolled right now in the College of Integrative Medicine. So I'm constantly updating myself so that I can help my patients get better. So this is probably the most important slide in the video, and you'll see that it says all chronic conditions have common threads. So if you're watching this video and you have fibromyalgia, I'm pretty much going to say that you don't only have fibromyalgia. And that's a paradigm shift, because if you think about it, doctors are saying you don't have anything, so let's just give you fibromyalgia. But meanwhile, they're also telling you that your blood tests are normal, and here I am telling you, you know what? You don't only have fibromyalgia, you have a bunch of stuff. So chances are you're insulin resistant, so your blood sugar doesn't stay stable throughout the day because you're missing meals, or you're waiting too long between meals, you're not having a breakfast because you're not hungry in the morning, or you're having coffee and you're having a bagel, and then the next time you look at the clock, it's 2 o'clock or 1 o'clock and you haven't even eaten, or you're eating way too late, and you're roller coastering your blood sugar ups and down. And that's going to be just as bad as having high blood sugar, because high blood sugar and low blood sugar, they lead to the same road, and that's insulin resistance. And insulin resistance, as you'll learn, is when sugar is not able to get out of the bloodstream, it's not able to go into the cells, and then you crash. So then you have a meal, you get lightheaded and jittery if you don't have a meal, or you also get anxiety if you don't have a meal right away, and then it's relieved when you have the meal. But not only is it relieved, you crash and you have that afternoon fatigue. So if that sounds like you, chances are, even though you've been told that your blood tests are normal, you're insulin resistant and you're trending towards diabetes. A lot of you have IBS problems or gastrointestinal problems, or you're having bloating or constipation or diarrhea or gas. A lot of you may have autoimmunities or a thyroid problem. Chances are you have a thyroid problem and you're on thyroid medication, and you've never been told that it's not only a thyroid problem, it's an immune problem. We'll get into that too. Chronic fatigue, I mean, no energy to live the life the way you want. Your friends ask you to go out, and all you want to do when you get home is crawl into bed and sleep. And no matter how much sleep you get, you're still exhausted, and you're cold all the time. I know, how do I know this? Because I see this every day in my practice. Painful joints. Fibromyalgia patients have swelling and painful joints and headaches and focus issues and just stiffness all throughout their body, and they get touched and it gets sore. I understand exactly what you're going through. Insomnia, not being able to fall asleep or not being able to stay asleep, or waking up exhausted, or all three of those things. Or not focusing. You know, you're coming out of a shopping mall and you don't know where you put your car, or you're in the middle of a conversation and you forgot what you were saying. those are brain fog issues. So the way we look about helping patients with a chronic problem like fibromyalgia, based on the fact that we have a lot of these chronic conditions, is we look at you from a metabolic point of view, what's going on metabolically, and we look at you from a neurological point of view, meaning what's going on neurologically. And we'll go over that in this video. So the take-home lesson in this particular slide is that all conditions are a common thread amongst other conditions, and there's a lot more things going on than just what's being told as fibromyalgia. You have a difficult ability making energy and digesting your foods and having inflammation in your body, and then you have a neurological imbalance as well. And we'll talk about that, because I tell patients that have fibromyalgia, you're not crazy, but at the end of the day, the problem is in the brain. The brain is not synapsing and is not getting the fuel and is not getting the oxygen and the glucose and the stimulation in order to put the brakes on the gas pedal, if you will. And so you have this sympathetic escape. And that's a really take-home key point, because a lot of you that I consult with have gone to 5 doctors and have been doing different tests and hormone tests and food tests and stool samples and other testing, but yet no one ever tells you what's going on neurologically and what you can do neurologically to help you. So some of the metabolic conditions that we see that patients have that aren't being told that have fibromyalgia is they have anemia problems. Not anemia enough to say it's diagnosable in terms of all the lab ranges are low and it's an ICD-9 code that fulfills the requirement, but you could have 1 or 2 things that are trending towards the low area. You're getting a C+ in that grade, and just because you're not sicker than the average person that takes the blood tests the year before, which we're going to get into in a couple moments, then you're told you're normal. And that's absolutely ridiculous. I have twins, and they're now 12 or 13 years old. And I tell my people in my workshop that medical model is the analogous to school giving the kids a normal grade when they have a C+ or a D, and giving them a failing grade when they have an F. And if they're not getting an F, they're told that they're normal, that they don't need any extra help or any other homework assignments. They just are normal. And that's a shame, because that's the same thing in the medical model, where unless you're failing the grade, you're not being told that you need to fix this or fix that. Maybe they're telling you to eat healthier or exercise, but many of you don't have the energy to exercise because you're exhausted and you're in pain, or you've done that and it hasn't helped. And I know that you're probably eating quite healthy and you're still suffering. So maybe there's a couple foods that you could probably do better with, but at the end of the day, it's not like you're a glutton and you're eating whatever you want and you're still suffering. I know what you're going through. So unstable blood sugar we talked about, adrenal gland dysfunction, that was what I was dealing with. I can't tell you how many times I'll do a workshop and my patients say that they've never been told about their adrenal glands, or they were measured their adrenal glands in their blood work and it showed that it was normal, or their doctor thinks they're crazy because there's no such thing as adrenal fatigue. These are things that I'm hearing, and the bottom line is that the adrenal glands, if you are suffering with fibromyalgia, need to be worked into the equation in order to be assessed so that we can get you better. Hormonal imbalances, many patients go on bioidentical hormones and their doctors don't really know what they're doing, and then 5 years later they're still on these hormones and no blood tests have ever been redone to check what the levels are again. And what's happening is you get down regulation of the receptor sites, which means basically you're flooding your body with too much hormones and they can't get in the cell, and the cell has basically closed and locked the door for it to get in there. Autoimmune conditions, most of my patients that have chronic conditions are autoimmune patients until proven otherwise. So when you come in and we consult with you, you're told that you're autoimmune until proven otherwise. Gut infections, bacteria, overgrowth. You know, I watched a video the other day and it said that basically for every cell, human cell in our body, we have 100 bacteria cells. So we have healthy bacteria in our gut. And if that unhealthy bacteria gets overridden by unhealthy bacteria, then all of a sudden you have these fatiguing and pain and bloating and autoimmunities and inflammation, and that's more than likely what's going on. And so I would again say, if no one's ever worked with you from an autoimmune perspective or from a gastrointestinal perspective or an adrenal gland perspective, then as a fibromyalgia patient, you aren't being worked up properly. And so write that down. Let's get into that a little bit. I am the son of a family that's traditionally medical doctors, and medicine does a great job when it comes time to an acute condition. So if you have a broken bone, God forbid, or you have a car accident, God forbid, or a stroke, or any of these acute type of problems, medicine is going to help you very, very, very effectively. But when you have a chronic condition, your blood sugar is imbalanced, you have an autoimmunity, your hormonals are imbalanced, you have a genetic predisposition, you have an anemia, you're not absorbing your foods, you have toxins in the body, you have heavy metals in your body, or you have a parasite, or you have stress from an in-law or a family member. How is one pill going to fix that? It's not. So medicine does a terrible job when it comes time to chronic conditions. And I bet you're shaking your head, yeah, it does a terrible job, because I'm still suffering. And I counted someone in my office the other day that is taking 21 pills. He's 90 years old. I'm 45 years old, and I couldn't imagine what 21 pills would do to me, let alone a 90-year-old. So, you know, you just can't medicate yourself to good health no matter what you do. And that's the theme of this presentation, is if we can get down to the actual cause of the problem, then we can fix that problem, and we can get you the life that you deserve. And you can go out, and you don't have to go to bed as soon as you get home, or you can have increased libido, or you can travel, or you don't have to have brain fog or swelling or migraine headaches. These are things that we can aspire and we can really get you towards, because I think it's a goal that's good enough to try to achieve, and we can get there. I really believe that. Food sensitivities, I guarantee that there's a chance you're reacting to gluten. I think everyone should be off of gluten. Gluten is the devil, I joke around, but yeah, get off of gluten. If you didn't listen to anything else that I told you and you just said, I get off of gluten, that'd be great. But the problem is that you have cross reactions with other foods that are like gluten. So you go to the gluten-free section and you eat gluten-free bread or gluten-free crackers, and it has sorghum or rice or corn or buckwheat or millet or hemp or tapioca. And the problem is you're reacting to those too. And what I tell patients is, how do you know if you're reacting to those? And the answer I'll tell you is you test. And guess what? Many of the times your doctor doesn't A, know about these tests, B, won't even order these tests, and C, insurance won't pay for it. And remember what I said about medical model. It does great with acute conditions, but it doesn't pay for a lot of these things, because at the end of the day, it's wanting you to take a drug approach. And if you are going to spend money on tests that are going to help you take a non-drug approach, typically it's not going to be covered. And it's a shame, but it is what it is. So I say, don't shoot the messenger. We are going to go over how much it's going to cost at the end of this video. You'll know down to the dollar what it's going to require. And the last thing is that I require all my patients to at least be an 8 out of 10 on how much they are suffering and they're willing to change their life or do the things that they need to do to get better. If you're a 7 or less and you're watching this video, you may not want to watch it anymore, because you're going to have to make some serious changes, whether it's accountability for your health, or it's getting off of certain foods, or trying to do exercises to stimulate your brain. There's things that you may have to do that are going to be uncomfortable, but it's going to get you better. And so you have to be at least an 8 out of 10 on how much you're willing to do to get better. And also, you have to watch this full video, because I give you 45 minutes of my time times 2, 90 minutes. And I don't want to spend my time explaining what we're doing on this video. I want you to understand my video content before you come to my office, and then you're like, yeah, I need to go see that guy because he's saying everything that I'm suffering with, and I'm willing to do whatever it takes to get better. Because I don't want to sit down and you have your arms folded and be skeptical and wonder how much it's going to cost you when you're not on the program. You're not up with the program. I want you to be willing to run through walls because you are suffering and you just don't want to suffer anymore. That's the kind of patient that I want to help. All right, going on. So, metabolism. Metabolism, what does metabolism mean? I say that every patient that comes in with a chronic condition like fibromyalgia is suffering with a metabolic problem. So what does that mean? It means that you're not converting food into energy very well. That's basically how I define metabolism. You would shake your head and say, yeah, I don't think I'm making energy very well. I'm tired all the time, I have brain fog, I crash in the middle of the day, I'm in pain, I have swelling of my joints, it's sore everywhere in my body, my gastrointestinal system actually is painful, I don't know what foods I should be eating, I don't have the energy to exercise, I'm waking up with exhaustion and I'm tired and I'm cold. I mean, if that sounds like you, you're not making energy very well. So one of the questions I always ask is, if you're not making energy very well, then systems of the body need energy in order to function properly. What do you think system in our body requires the most amount of energy? 30% of the total energy. And the answer to that question is the neurological, or the nervous system. So your brain and your spinal cord and all your nerves, it's metabolically active and it needs fuel. So if you have no ability to break down food and you're metabolically not working properly on the inside, then that energy is not going to get into the cells, and specifically the nervous cells, and so you may have numbness, tingling in your feet, you may have weakness, you may have cognitive changes, you may have postural changes, you may not be digesting your foods, your respiratory function could be off, you're not detoxing. All of these things that require energy in your body to happen naturally is not getting the fuel. And then next thing you know, you're exhausted and you're suffering with fibromyalgia. So I tell patients in my office, all cases are a combination of metabolic problems and neurological problems. And it's just my job to figure out how much is your case being contributed from the neurological problems and breakdowns, and how much is it being contributed from the metabolic breakdowns. And when we figure those things out, we can get you better and give you the life you deserve. So let's talk about your nervous system. Basically, you know it consists of your brain and your spinal cords. The brain is the major center, the computer, and the nerves are the communication centers. And if there's a disconnect, then potentially we don't have good balance. Potentially we are going to be in more pain. And think about that. When we have sick neurons, they are quicker to fatigue and quicker to fire. So what does that mean? It means we typically have a threshold of our neurons so that when it reaches an action potential, it fires. And what happens is it requires a certain amount of changing of the voltage of that nerve. But when that nerve is sick, then it doesn't take very much to have it fire, but then it doesn't regenerate and it fatigues. So an example of that is someone who gets tired very quickly when they read, or someone who has a lot of pain when you touch them. And so those nerves are quick to fire and they're quick to fatigue, and next thing you know, you're dealing with sick neurons that aren't getting enough fuel, and no pill is going to fix that. I mean, really, what pill is going to fix that? So each cell depends on these nerves to fire properly. And so let's talk about the body-brain connection. Your brain is one big sensory organ, so it takes in information from the environment, whether it's from the receptors in your feet or your skin or your muscles, whether it's from your eyes taking in visual stimulation, or whether it's your smell, your nose going to the frontal lobes and temporal lobes for smell, or whether it's your hearing or your taste. At the end of the day, your brain is one big receptor. And so if your brain is not getting the proper reception to the brain, you're going to have mistakes inside the brain. And so one of the questions I always ask is, what are the two big receptors that are constantly being stimulated on a day-to-day basis? And it's touch and gravity. So what that means is we're always being stimulated. Our brain always needs stimulation to survive. There's three parts of the brain. There is the cerebellum, which is basically responsible for balance. We have the cerebrum, or the main part of the brain, where all our lobes are housed, where our focus and our concentration and our memories and our emotions and our ability to touch, our ability to hear, our ability to do coordinated movements, all of those things. And then our brain stem. And our brain stem really houses a lot of our cranial nerves that are responsible for automatic things that happen in our body, like breathing, digestion, respiration, all of those things. And we're going to tell a little bit about the connection and what breaks down when you have a fibromyalgia patient. So basically, sensory information from one side of the body goes to the cerebellum first. So if we touch someone on the right side of the leg, it goes through the nerves, up the cord, into the cerebellum on the same side. Then it is sent to the opposite side of the cerebrum, and then from there it goes down the opposite side of the brain stem. And the brain stem basically puts the brakes on the whole process. So if we are losing our ability to slow that down, then you could have what's called sympathetic escape. And that's typically what fibromyalgia patients are dealing with, and that's typically what medication will work with to try to slow down the sympathetic firing. So what are some of the symptoms you may experience with an overfiring sympathetic system? Number one, chronic pain and chronic fatigue. I mean, who of us with fibromyalgia have that? Irritable bowel, urinary tract infections, fibromyalgia, migraine tension headaches, poor posture, adrenal gland stimulation, blurred vision, increased sweating, difficulty falling or staying asleep, dizziness and vertigo, heart palpitations, increased heart rate, increased blood pressure, cold hands and feet, sensitivities to sound. So that probably sounds like you, then there's a neurological loop that is not getting slowed down, and it's just getting out of hand, and it's leading to all of those symptoms. And that will also cause problems along the way in different areas. So cerebellum, we see a lot of cerebellar fatigue in our office with fibromyalgia patients, and we'll do cerebellar rehabilitative training, and we'll see that the balance comes back, vertigo comes back, or goes away, chronic neck pain and headache pain goes away, clumsiness, disorganized thinking, lack of output to other parts of the brain. That's what's happening when that cerebellum is not working properly. The next thing that happens is our different areas of our brain break down. So we don't have an inhibition of our frontal lobe or our parietal lobe. So what will that mean? It may mean that we have depression and anxiety. We have difficulty scanning pages when you're reading, or difficulty with your adding and subtracting, or difficulty saying the words, they're there but you can't spit them out. Difficulty understanding the words, so you can hear it and then it's someone, your husband or wife may be talking to you and you're hearing what they're saying, but it's just not comprehending, and then they look at you and then all of a sudden it's synapses. That's a problem with your neurological feedback loops. Difficulty learning new things, you're just not sharp on the ball. Altered sensation, changes in handwriting, so you may notice your handwriting has changed. Weakness, lack of motivation, you don't want to do things. Learning disabilities, these are all things that I tell patients that this is what could be related, and they're like deep down when we do a neurological exam with you and we determine if this is what's going on, it's going on, and a pill won't fix that. You can't medicate yourself to good health. And so when we get those brain exercises firing, next thing you know, you don't have the brain fog. Next thing you know, you're putting the inhibition to this loop that's going on, and you're not sweating, or you're not anxious, or you're not heart palpitating, or you're calmer. And we see this every day in our practice. So one of the things I like to tell patients is this loop, this fibromyalgia loop. So basically what happens is that brain stem sends information down the spinal cord, it goes to the adrenal glands, it releases hormones, and it causes pain. And that's one of the loops that we have. And then we also have difficulty sleeping. Another loop we have is that brain stem fires the most at night, so we can't fall asleep. And it fires the least in the day, so we're crashing around 3 o'clock. Or what about the brain fog? We have emotional stress. It causes chemicals to be released in our brain that goes to our adrenal glands, and that creates a over-releasing of cortisol in our adrenal glands, and that causes a brain fog and problems with focusing. Or we have an overfiring brain stem. It causes dilation of the vessels, and next thing you know, we have migraine headaches. So these are all the triad of the fibromyalgia problems that develop when your brain is not able to effectively slow the engine down, if you will. And so why does this happen? Physical stress, chemical stress, emotional stress, fewer nerve impulses are happening in the body. And so let's talk about that. Potentially, remember, let's relate this back to the metabolic side of things. Maybe you're not making energy properly because you have an anemia problem. You're not absorbing your B vitamins, or you have an iron deficiency, or there's an infection, or there's a heavy metal problem, or there's an absorption problem, or there's a genetic problem where you're not methylating. There's a lot of things that can go wrong, and guess what? We can figure those out based on your blood work if we look at your blood work a little more narrowly. Maybe there's a sugar imbalance. We talked about this, not having a meal, waiting too long, having too sugary foods, eating at the wrong times of the day. Even though your blood tests are normal, we can determine that. Having a reaction to gluten or dairy or soy or egg or corn or rice. I see this every day in my practice. Poor diets, having too much hydrogenated oils and fast foods and processed foods and sodiums and things that don't have a lot of minerals and vitamins and nutrients in it. So we become almost malabsorbed, even though we're obese more than we've ever been. Or maybe there is a thyroid problem or inflammation, or prescription drugs, you're having reactions to these xenobiotics, or you've been on antibiotics and there's no more healthy flora in your gut, or you have an hidden infection. All of these things are going to slow the process of the brain so that you don't put the brakes on and the sympathetic escape happens. I hope that's making sense with you and saying, yeah, why has no one ever told me about this? No one's told you about this is because a pill won't fix this. That's why. So emotional stress leads to adrenal gland disorders, cortisol becomes imbalanced, and how do we know? We know because we do saliva samples, and we test your saliva at 4 different times of the day, so it should be nice and high. You should bound out of bed in the morning. You should sort of have a little less energy as the day goes on, and then when you hit the pillow, you fall asleep like a baby, and you wake up and you do that the next day, over and over and over again. But because our adrenal glands are so bankrupted, then basically we wake up with little energy, we don't have energy throughout the day, we may have a good day, but then the least little bit of stress that we find out that little Johnny got in trouble in school, or your spouse yelled at you, or your boss was being a jerk, or a bill was due that you forgot about, then the next thing that you know, you're exhausted and you can no longer focus and you have increased flare-ups. So we need to test that and see where you're at. Are you at an acute response where it's high no matter what time of the day we look at it? Are you at a chronic stress response where it's low no matter what time of the day we look at it? Is it dysregulated? Are you high, then low, then high? Or is it low, high, low, high? Each way that it's going to go wrong is going to be another way for us to try to fix it versus just giving you a pill and taking this. And that's another point is you may be taking all these supplements and you're not getting better because it's just like a pill. You're only taking the supplement to try to fix this symptom when it's not actually trying to address the cause. And I can't tell you how many times I see patients that bring I'm not joking, a Santa Claus bag of supplements, and they say, why are all these not working? Well, the problem is you're not absorbing very well, and you're just doing a piecemeal, taking this for that, that for this for that, and at the end of the day, you're not working and fixing the fundamental breakdowns that are occurring in the body, and hopefully that makes sense. So there's a journal that said that chronic conditions, the faster your brain dies if you have a chronic condition. The longer the individual has fibromyalgia, for example, the greater the gray matter loss is, and with each year of fibromyalgia being equivalent to 9.5 times longer than the normal aging process. So basically what that's saying is with fibromyalgia, brain matter is dying. And that's a big problem because, you don't want to be in your 60s or 70s and not remember your familiar faces or your surroundings and not being focused and lucid and really being able to do the things that you want to do. So we do brain-based therapies in our office when the patient comes in because you know what, the great thing about the brain, it's like any other muscle. If I had a bicep weakness, I had my arm in a cast for 3 months, of course my muscles are going to atrophy, but what do? I do exercises. And we can do exercises for the brain based on how we know the different pathways go to the different parts of the brain and stimulate that because there's something called neuroplasticity where your brain learns and it reorganizes itself. So key points of neuroplasticity, your brain changes when stimulated. And different types of stimulation can help different areas of your brain. oxygen we use in our office, we use visual exercises, we do balance and coordination, we do stimulation to the nerves, we do smells, we do spins, we do a lot of different therapies that will help patients with their brain-based problems. We do therapies that other offices don't do, where we do advanced auricular therapy or olfactory therapy or interactive metronome, iPad applications. We do a bunch of different things that is different than anything that you've ever done. We also do visual or auditory stimulation or eye exercises, and so that's what we do from a neurological point of view. From a metabolic point of view, we have to determine what's going on. Do you have low-grade anemia even though your blood tests are normal? Do you have insulin resistance even though your blood tests are normal? Do you have food sensitivities or immune breakdown or adrenal gland imbalances or hormonal imbalances or thyroid dysfunction or inflammation or hidden infections? I would answer yes, you have those, and no one has ever told you about that. And how do we know if you have those? We have to do the proper tests. Bottom line. But you know what? The problem is you have a lot of tests and you've been told that they're normal. And the problem with that is because lab ranges are so wide and they're inaccurate because they're based on the people who took the lab test the year before. And guess what? Everyone who's taking the lab test the year before is getting sicker and sicker and sicker. And our healthy population is few and far between. So you're being compared to those sick norm people, and you're being told if you're not sicker than they are, then you're normal. And that doesn't fly with me or my family, and it shouldn't fly with you. So what that means is we need to look at the lab ranges from a healthy point of view. Wouldn't you rather be compared to someone who's healthy and then saying, okay, you're not normal because you're not healthy, versus, okay, we're comparing you to someone who's sick and we're saying you're normal because you're not sicker than they are. That should be like an eye-opener for you. Let's give you an example. As an example, with thyroid, TSH, the levels for a healthy thyroid is 1.8 to 3.0. But from a lab range, when you look at it from the lab range, it's 0.3 to 5.7. I mean, that's a huge difference. That means if you're told you're 4.2, it's not going to flag it. It's going to say it's normal. But meanwhile, it's outside of the healthy ranges. And that's, you know, that's worth the price of admission for me, just going over your lab ranges and telling you, hey, Mrs. Jones, your thyroid levels are off. You have a blood sugar imbalance. You have low-grade anemia. I can't tell you how many times I've actually done that. And patients get upset with me because they say, well, my doctor never told me that. And I say, well, your doctor is unfortunately still listening to 8-track tapes, and we have these new things called MP3 players, or we can play things from a satellite and listen to music we don't even have to download. It just gets streamed across the internet. What does that mean? It means that your doctor is practicing acute-based care. He doesn't have time to spend with you like he did 10, 15 years ago because he is getting paid less from insurance today than he did 10, 15 years ago, and that's a fact. So what does that mean? It means that Medicare will pay more for a visit 10 years ago than it does today. But he also has increased overhead, increased staff, increased bills, and so he has to spend less time with you in order to make the same amount of money. So I always joke around and I say, sort of rhetorically, who do you think reads the lab test these days? And a lot of the patients will kind of laugh and say the nurse. I say not even, the computer. The computer reads it. If it's lab high or lab low, then it's flagged with an H or an L. Or if it's within those ranges and you're not sicker than that average sick person, you're told that it's normal. And that's a huge problem because you still suffer, you still have fibromyalgia, you still have chronic pain, you still can't focus, you still can't sleep, you still have migraines, you still have gastrointestinal problems. But don't worry, Mrs. Jones, because you're normal. But I don't feel normal. Well, then why don't you take an antidepressant, because that will make you feel better. I mean, that's kind of where we've gotten today, and I hope you're shaking your head yes, saying, yeah, that's where we got, and I need to see you because you're the one that will help me. And I believe that I am the one that will help you. So metabolic treatment, there is one reason we are getting chronic patients better, because we're running the necessary tests, and we're looking at the tests from a functional view. And you know what the problem is this is vastly different than the PPO or HMO model, where they just do the tests that they're allowed to do, and they give you a pill. And you know what? I ask my patients that I see all the time that have these tests that are out of ranges that no one ever told them about. And I say, why did you go see the doctor for so long? And they say, well, they were in my plan. And you know, I say, well, that's true, but I can give you a free dinner card for the next 5 years, and it's going to make you sick, but you're going to still go because it's bad food. That's kind of the analogy I use, and it sucks because that's where we are at in today's day and age. But the problem with that is that we spend money on different things that we don't spend on ourselves. So we buy a cell phone, we go on cruises, we go out for dinner, we buy clothes and shoes and another pair of shoes because they're on sale or whatever it is. But when it comes time to spending money on ourselves, we expect insurance to pay for it. And it should pay for it. Don't shoot the messenger. I really wish that it did, but it doesn't. And should you care if this is your life and you're not getting the care you want and need and you're being told you're crazy and nothing's wrong with you? Should you care that you found someone that understands the functional point of view from the body and the neurological point of view of the body and is saying it's going to cost you some money out of your pocket to get better? Should you care? You shouldn't care. I mean, yeah, you should be a little bit upset and we can write Congress together, but at the end of the day, you just got to get your life back and you're in charge of your health. So based on what I've been talking about, we run complete blood chemistry, we run salivary hormone panels, we do homeopathic protocols in our office, we do saliva samples, we do genetic testing, we do a lot of different things in our office. I want you to write down Cyrex Labs. Cyrex Labs is one of the best labs that will test for antibodies to different foods. So we do that all the time. It tests for leaky gut, it tests for autoimmunities. How many of these tests have you had done for yourself? Probably not very many. And so basically it takes someone like House, the doctor on TV, to sit down and put all the sides of the Rubik's Cube together and say, you know what, we're going to fix you by looking at what's going wrong and get to the cause of the problem. So that means we do testing, we do periodic follow-ups, we look at your cortisol levels or your brain imbalances or blood sugar or anemia problems or absorption issues or genetic problems, and we basically get you better that way. So what's next? What's next is for you to take advantage of my 2-visit special. If you've watched this video up until now, then what that means is I'm going to give you a special offer. And the offer is, it's a $75 2-visit 45-minute special. So that means you don't have to pay $75 both times. It's $75 for 2 visits, and it's usually $149 for those visits. And what do I do? So basically, we're going to send you off my paperwork. You're going to fill out the paperwork. It's about 20 pages. It gets into environmental histories like mercury or toxic exposures and molds. Your family history, did mom or dad have anything like this? Or aunts and uncles, or nieces and nephews, or children or grandchildren, because that's going to be very helpful for me. How was your immune system as a child? What are the 3 things that you're looking to get better? How's your dietary history? And what does this cost you in terms of time? We go over that with a fine microfine glass, if you will, because I don't want to leave any stone unturned as to what could be contributing to your condition. We also have you fill out our paperwork that has questionnaires, and that will give me an idea based on the 0s, 1s, 2s, and 3s. What you fill out is if you have 1s, 2s, or 3s, or 2s and 3s, or 3 out of 3, then I know you may have a cerebellar problem, or a frontal lobe problem, or a adrenal problem, or blood sugar problem, or liver problem. I can tell that even without looking at your blood work. So if you don't have blood work ready right away, don't worry about it, because we need to get started as soon as possible. Also, I'll look at your blood work and we'll put it on that functional scale, and I'll report to you back as to, oh, you know what, did you know you had these problems or that problem that no one has ever told you about? And then I do a full neurological examination where we look at your parietal lobe, see how well you're sensing. We look at your vibration sense. We look at your eye movements. We look at your ability to smell, your ability to stand in one place. We look at repetitive movements. We look at your blind spots. We do a lot of stuff. We require you to be with a spouse if possible. It's very hard in today's day and age to do that because both spouses work or one spouse is traveling. But I think it's really important for a spouse to be here and see that your fibromyalgia problem is not just a fibromyalgia problem. It's a balance problem, or you can't smell, or you get dizzy when you stand up, or you have a focus issue, or you can't feel your toes, or your coordinated movements are off. I see that all the time, and when you go home and explain this to your husband or wife that you have these problems, they can't appreciate it unless they see it on that day. And if they really cared about you and they were concerned, they would be here. On day 2, what we're going to do is we're going to go over your case and what I do. So we're going to explain to you, hey, this is what I found based on your blood work. You have a couple concerns in these areas. This is what we talked about in your history, and no one has ever told you about your environmental exposures, or I reviewed your blood work and no one ever told you about this. This is what we found with your neurological exam, and this is what we need to do to fix it. And I'll tell you down to the dollar how much it's going to cost. And I want you to be with a spouse specifically on day 2, because when I go down to the dollar and say, okay, Mrs. Jones, I want to do a saliva sample, I want to do some genetic testing, I want to put you on a detox program, I want to do some brain exercises, I want to also get you focusing and reducing these foods and testing for these foods, and you say, okay, well, I got to go home and think about it, or I got to go home and ask my husband, then that's a wasting of your time and my time, because I see a lot of patients and I would rather you tell me, no, I can't do it, or yes, I can do it, but I need to start slowly, or let's just do this, or let's just do that, or let's do all of it and I can go forward, because I want to get you better and I don't want to waste time, and I want you to be with a spouse so that you don't have the option to say, I'm sorry, I have to ask my spouse about that. Hopefully you appreciate that and understand that that makes sense. The thing is that I only accept 5 new fibromyalgia patients per month. I see a lot of patients that have thyroid problems, or peripheral neuropathy, or brain exercise problems, or IBS and Crohn's problems. I have a lot of different patients that we see. Like I said, we usually charge $149 for the visit. I'm going to charge you $75 if you've watched this entire video, and that makes my time a lot more easy for you. If I don't feel I can help you, I will give you your $75 back. The last thing I want you to know is that you have to be making changes to your life. I am not going to accept anyone who is less than an 8 out of 10 on how serious they are and what they're willing to do to get their life back. You have to be responsible for your health. It's not your insurance's job. It's not your government's job. It's not your boss's job. It's your job to get yourself better, and I believe we can. Insurance will pay a small portion of what we do inside of the office. So what that means is we will run your insurance, we will tell you what kind of benefits you have, and we will tell you down to the dollar when you come back on day 2, okay, Mrs. Jones, here's my best recommendation. It's going to include all these, and these things for metabolic testing. It's going to include all these, and these things for neurological treatments, and it's going to cost you this amount of money. I can't tell you because it's different from everyone, but what I do tell patients is it could be anywhere between $200 to $400 if you finance it for the next 12 to 24 months, somewhere in that ballpark. Now, it may be different if you have insurance benefits or you pay all at once, but we have third-party payers that can get the payment down to $50 to $100 to $75 per month. So I tell patients, if your health is not worth you paying $75 per month to get better, then I'm sorry, I can't help you. It's not worth it. You're not sick enough, and your life is not on hold as much as it could be for you to realize, hey, if I pay $75 and it's going to make me better, then that's a bargain. So I will only want patients that are willing to make those changes. So like I said, it's different for everyone. I wanted to give you a ballpark, and that's the ballpark. But what I want you to do now is ask yourself, how serious am I? Am I an 8 out of 10? If you are, give my office a call. How is this affecting your life and your loved ones? Are you able to work? Are you able to be productive? Are you doing the things that you love to do when at the age that you are now and you're enjoying life? Are you in pain all the time? Do you think that this is going to go away? Where are you going to be in 2 years if this doesn't get fixed? I really hope that you enjoyed my video. I hope you got a lot out of it. I want you to give my office a call now. It's 561-883-0090. Let David or Sydney know that you watched the full-length video in its entirety and that it's a $75 special. Otherwise, I'm going to tell you when I send you follow-up videos, it's going to be $149. So take advantage of this limited time where it's $75. I look forward to being your health coach, giving you the hope that you deserve, and getting your life back. Thank you so much.